Good morning. Welcome back. You're still watching Daybreak on this 23rd day of May 2023, and it's time to introduce the panelists here in the studio. My name is Sam Gituku, and we're still expecting the arrival of Peterson Washira, who is the chairperson of the Kenya Union of Clinical Officers. But in studio, I have Donald Ngalula, who is a nurse, has been a nurse since 2019?
2020.
2020. And then we have Dr. Njoki Fernandez. Did I just say that right?
Yes.
She's a consultant in matters healthcare, but also a doctor, obstetrician.
Yes.
Gynecologist. Good morning.
Good morning.
It's been a while.
Yes.
Dr. Bethel Libea is a pharmacist since which year? 2020. 2020.
Yes.
And of course, you, like I said, you shortly be joined by Peterson Washira. And this morning, you're talking about the situation of the sector, that is health sector, in as far as human resource. And you know, there has been challenges. I was looking at a report of 2021 that over 46,000 healthcare professionals are either underemployed or unemployed. And the figures are showing about nearly 2,000 medical doctors still looking for jobs, more than 9,000 nurses still looking for jobs. We want to understand, especially from those that have recently graduated. Maybe you can begin with you, Donald, and tell us about your story, having to go through university, finishing your education, and now having to look for something to do. How has that been?
Thank you very much, Sam, for having us this morning. It's an honor. Well, I graduated in 2020 from Moi University. Completed school, officially completed in February of 2020, graduated 2020 December. Began my internship at Kenyatta National Hospital October of 2020 and completed in October of 2021. Well, it's always an expectation of many young nurses and other healthcare workers that upon completion, you are absorbed by your government that trained you into the healthcare system to come and offer services and support. But unfortunately, this is not the case as by expectation. And as a young nurse, I've had to look for other means or other sectors of the economy to find work that will be able to support me, whereas my expectation is to be absorbed into the public healthcare system.
What is that? Alternative sectors of the economy that you're focusing on now?
Well, at an individual level, I've had to go to research. I've worked with Cambridge. I've worked with Washington State University and also the University of Washington on short-term contracts as a research assistant.
So let me understand. So you cleared school 2020, graduated, and you did your internship. You're now ready to work as a registered nurse. So looking for work, what was that process like?
Well, it's normal like every other youth, sending applications and secondly, waiting for government or counties to advertise for vacancies. But what is unfortunate is the type of vacancies that are announced do not fit your qualifications because the specifics most of the time will be they need a diploma nurse or a certificate nurse. But now the place of the degree nurse is looks like limited. And then coming back to the issue of how do we even secure the same jobs in the counties, because I think it's common knowledge that for you to secure a job in the counties, or rather a national hospital, is another uphill task. So for me, it has been more of the same, waiting for advertisements. When you apply, you don't get feedback because of the volumes of the other unemployed nurses like me who are also applying. So chances of getting absorbed again are very minimal.
Would you know the difference between qualifying as a nurse at the degree level versus qualifying as a nurse at the diploma level?
Yes, sure. To begin with, qualifying as a degree nurse, you will take 4 years of classwork with clinical work and then 1 year mandatory internship. To qualify at a diploma level is 3.5 years of classwork and clinical work, and you get registered immediately. For a degree nurse, you are registered only after you've completed internship and you've passed your licensure exams. When you enter the job market, you enter at different job groups. So a degree nurse will enter as a nursing officer intern at job group K. A diploma graduate will enter at a lower job group. And the next difference is the difference in the scope of practice. So for a degree nurse, the scope of practice specifies specific tasks that this nurse can carry out. A diploma nurse can carry specific tasks. A certificate nurse carries specific tasks.
So they are lower?
Yes, yes, yes. That is what is expected about the scope of practice, that specific tasks should be handled at specific levels, and specific nurses can handle this specific type of tasks.
Okay, interesting. Dr. Libea, pharmacist, how many years now? Since 2020, you said?
2020, three years. Yes.
How's been your experience?
Thank you, Sam, for having me here this morning. My experience isn't quite different from Donald's. I graduated in 2019 from the University of Nairobi and did my internship at Mama Lucy Kibaki Hospital. That is in Eastlands for around 6 months, and then there are other rotations that we do in the industry and also at community pharmacy level. After I was done with my internship, I got registered in 2021. So that is when I officially began practicing as a pharmacist. And after graduation, vacancies for pharmacists aren't as much out there, especially in counties. There are some counties that haven't advertised for the last three years. They haven't advertised for pharmacist position, or if they've done, they're less than 5. And yet there are many of us out there who are looking for these slots. I haven't really pursued employment in the county government because of that. Number one, limited slots. Limited slots that advertised. Number two, same thing as Donald has said, the process of recruitment. There's a lot of corruption when it comes to recruitment in county governments. I know of colleagues that have been asked to tunes of around 500,000 as bribe to be shortlisted for interviews.
By who?
By county government officials. You know, since it's not a transaction that is receipted, some of them have ended up losing that money. And, you know, it's not a guarantee that you'll get that job, even after being shortlisted. You know, it's not that you're employed on a PNP basis. You are asked for that money to be employed on contract for 3 years. So we've got into that position as a country, which is quite unfortunate. And looking at the private sector, perhaps you may ask, don't we have opportunities in the private sector that can employ us? The answer to that is there's a lot of underemployment, as you've rightly mentioned. Underemployment simply means you have a place you're working, but the amount that you're being paid as salary isn't commensurate to the amount of value that you're bringing to that particular entity. So you have no other option other than to take those opportunities because you have bills to pay and all that. So I haven't had an opportunity to practice as a pharmacist per se. I haven't had an opportunity to put my skills into practice. I've been pursuing gigs, what I call side gigs, such as digital marketing, online writing. Those are what have been sustaining me as I look forward for greener pastures, hopefully. So that has been my experience.
This is interesting. Dr. Njoki Fernandez, I mean, how different was your time, and were these stories usual to hear that someone is graduating 3 years down the line, nothing to do to practice what they studied?
Thank you, Sammy, and good morning to all our viewers. The stories are very sad because in our time, okay, I'm much older than these guys. So I graduated in 2005. Is that correct? Yes, 2005. And it was very interesting because the day you finish your exams on Friday, Monday, the medical council has released your list of where you're supposed to be posted. A month from graduation, you have already been posted to your internship center. And you're already expected to report and start work. The current situation we are hearing, which is so sad, is that interns, the medical interns, and you know after finishing medical school, you have to do internship for a year, which is mandatory for you to get your license to start practicing. We have doctors who are sitting and waiting 8 months without being posted. And you wonder, what are these people doing? They're just sitting at home because you can't do anything and even forget the medicine that they learned. So it was immediate. Within a month, 2 months maximum, you're already working in your internship center. And this was something that was done by central government. I was pre-devolution, thanks be to God. So we were all posted. And after your 1-year internship, within a month of finishing internship, you have a posting letter from Mafia House to go and begin working in a government facility in the country. We never had these issues of delayed payments, interns not being paid. There will be a few delays here and there, especially when you're starting, but the system worked. If you needed to go for postgraduate training, you do your mandatory 3 years, then the same government, central government, would then sponsor you to go for your postgraduate training. So the stories that we're hearing now are so sad, so sad, and you begin to wonder. It's sad. I mean, I look at my colleague here who's a pharmacist. Pharmacy is a difficult course to study, and he went with it and he did it. And I'm sure in this country we do not have the number of pharmacists that we require to serve the people. That he's not able to secure a job is just tragic. And you see then what happens is that what he said is also very true. The private sector takes advantage because the government is usually the benchmark, the standard for looking after the healthcare professionals. If the government pays badly or does not pay at all, does not employ, then what happens to the private sector? They take advantage and they pay you whatever, isn't it? Because they know you cannot get better. Usually government was always a competition as far as healthcare resource was concerned. But now you find that our healthcare professionals, and I think it's across the board, who are really unemployed. And it's very underemployed or unemployed. And it's very sad, and begins to ask, what does this do then for our people who we are supposed to be treating? You know, ultimately, that's the end of the day. So it's very sad, and we lived in better times, and I really hope that one day we can go back to where we were when things actually worked.
So for how many years did you work in the public sector?
I was absorbed by private sector almost immediately, you see, because they wanted us, and of course the pay was much better. So I worked in the private government for a very short time, because that time, I think I worked for a year or so, because they wanted us to really go and work in the private sector, and it was attractive. Okay. So we went, and that was it. Yeah.
I'll get back for more, but let's bring on board Peterson Wachira, who is the chairperson of Kenya Union of Clinical Officers. Good morning.
Good morning.
Right, and you're just setting the stage, the crisis that is in the human resource, the health sector across the country. I don't know, yourself, what is your story and how are the clinical officers faring? I see some statistics from 2021, over 6,000 clinical officers were either, I actually think they were jobless.
Yes. Thank you, Sam, and good morning, viewers. And thanks for giving us this platform to discuss this important matter. The unfortunate story that you have heard from my 3 colleagues here resonates across the board. Actually, for clinical officers, it is 12,000.
12,000 now?
Yes. And the issue of unemployment started even way before devolution. In 1999, I think that is the last time other health workers, apart from doctors, were absorbed directly into the public service. And from then, I think for us, all the others, except doctors, had to look for opportunities and wait for adverts for them to be employed. And I think that is where we actually dropped the ball. As a country, our health sector is on autopilot mode. We actually do not plan. We don't have any deliberate plan that would tell you that for us to arrive here at this time, there are these steps we are taking in terms of HRH. And basically, that is the root of the problem. The other problem is that we have communication and coordination gap and disconnect between the national government that is supposed to make policy and the implementer, who is the counties, who are actually supposed to be implementing these policies that are made by the national government. And there seems to be confusion or a lack of political goodwill especially when it comes to cascading the policies downwards from the ministry. If you look at it, it seems like the counties are not very happy with the, getting policies from the national government, and the national government, that is the Ministry of Health, has no way of enforcing the policies that they make to ensure that the counties actually do follow them. And that now underscores the problem that we have with the human resources, because we have very nice policies.
Right.
For all the things that we are talking here, we have very, very nice, very well-thought policies that are somewhere in a shelf, gathering dust, just because we decided to politicize our health sector. Now, the problem is, when my friend here has been unemployed for that long, and my colleague here, and the many nurses out there and clinical officers and all the doctors who have joined us, what it means is that for that patient who is going to that hospital, because we have a dire shortage, and this shortage is something that is very well documented within the Ministry of Health and the county government. Yet, we have people who are frustrated and having mental health issues outside here because they were trained and they're actually not working. What it means to that patient is that when you go to that hospital, you'll have probably to have longer waiting times. When you are seeing that clinician, they are not going to give you their best because they are fatigued because of the shortage. They have seen so many people. And work-related fatigue brings with it stress factors like fatigue, mental crowdedness.
Right.
So this person will not be able to actually understand you and diagnose you well. You are going to get complications, which you are going now to go and treat somewhere else, probably in a private sector. It is going to make the cost of health to go even higher. And it is a whole cycle that shows what is actually wrong with our health sector. Because when you talk about the systems in the health sector, the 6 systems, the 6 components of the system, it's like a machine. It's like a conveyor belt with cogs. And the central cog that rotates all the other cogs to convey that good health to the other side is the human resource. Without the human resource, it doesn't matter whatever else you do have. It doesn't work.
Right.
I happened to visit some facilities, especially level 4s, across the Lower Eastern part of this country, and 80% of them, level 4 hospitals, sub-county hospitals, were not able to do basic blood tests that are required. A good number did not have operational theaters. The theaters are actually there, but they're not functional because they do not have the human resource. The radiology departments were closed. Not that there are no machines, but actually because they do not have the human resource.
Right.
And that is just a sample.
Right.
Because they can.
But you haven't told me about your story. When you qualified and how long you've practiced and what has changed?
Yes, I qualified in the year 2010. Between the year 2010 and 2014, I worked in the private sector. Then I joined the border response, went to West Africa for 6 months, came back, and in 2019, we were absorbed. For those of us who had actually gone for the mission, we were absorbed into the ministry. So for about 9 years, I was actually in the private sector. Not that I wanted to be in the private sector, but because the public sector could not actually be able to absorb us.
But the terms, what was better, private or public?
I would say it depends. If you're working in an NGO, it's always better than the government.
Okay.
If you're working in the private sector, it depends on the level. If you're working in a higher level of a private sector, of course the pay is way better than the government. But if you're working in the low-level facilities, of course, the pay is going to be below that of the public.
And for clinical officer, what do you need to study? At what level?
So for clinical officers, we have diploma that goes for 4 years, 3 years in class, and 1 year internship, mandatory internship. And we also have a degree that goes for 5 years. That is 4 years in school and 1 year mandatory internship. Yeah, that you actually do have to do, so that as a prerequisite for your licensure by the Clinical Officers Council. Yes. Okay, interesting. I want us to take a short break. When we come back, we'll be getting to understand how these various cadres interact with each other at the university, not at the university, but at the hospital setup, but also looking at what has been changing the situation in the counties, what skills are needed, but also there's a policy by the Ministry of Health, that's a draft policy on migration of healthcare workers. We'll talk about that after the break.